So do you guys want to hear something absolutely insane? Your team is forgetting to do this one simple thing after patients say no to treatment, and it is costing you thousands of dollars in missed opportunities. And I know this because I have trained over 150 dentists through our aligner education platform, Clear Aligner Advisor. And something to note, those dentists went on to generate over $9 million in revenue solely from aligners, and almost all of them admitted that their team was not using this protocol. And once they did, they started to get more aligner case starts. Cases just like these that you can do with your patients. This is Dr. Chris. He started implementing the protocols from this system, and he saw a huge increase in cases, averaging up to 17 cases a quarter. So I'm showing this all to show you guys that even if you aren't doing any cases, this strategy can work for you. But it wasn't always like this. Before I knew that the fortune was in the follow-up, I was letting patients leave and just walk out the door after they said that they need to talk about it or think about it. And we never followed up with them. I felt like if we followed up with them, we'd be bothering them or pestering them. And I didn't want us to come across as salesy or desperate. And so I spent hundreds of hours and I tried countless strategies, and I found more ways on how to do this the wrong way before I figured out how to follow up with patients in a simple and effective way. And what it is a simple system. It's called the Clear Fortune Follow-Up System. And so what I'm gonna do is I'm gonna talk about why practices don't do it. We're gonna talk about what happens when they do, and then we're actually gonna go through and walk you through how to do it. And if you stay with me until the end, I will share with you a bonus strategy that you can implement to throw gas on this fire and really maximize the opportunities in your practice. Something to remember, as always, this training works for all brands. It does not matter who you're using, just use the strategy and apply it to whatever brand you're using. So let me ask you this. Have you ever felt like you're losing patience to, I need to talk to my spouse, and then you never hear from them again? I used to be in the same situation, and I was frustrated by how many patients would come in and say they needed to talk to their significant other about treatment, and then they never came back. And I knew we were losing these opportunities, but I just didn't know how to fix it. I realized we didn't have a system for follow-ups. My team felt like they were pestering patients, and they didn't see the value in calling patients. And so we also didn't have a consistent script. So every call that they jumped on, it felt different. And I was determined to change this. So I researched and I created a simple, effective follow-up system. And I trained my team with a clear script, and I explained why these calls were crucial. And the results were amazing. Our follow-up calls became smooth. Patients appreciated the extra care. We saw a significant decrease in ghost patients, and our practice grew. And so by addressing these issues, we turned a frustrating situation into a success. And now I want to do the same with you. So let's talk about why practices don't follow up with patients. So the first and most obvious thing is there's no system, right? There is no system that practices have. So everything is going to feel different. There's going to be no structure. And so when there's no structure, things are going to be all over the place and become unpredictable. And following that, there is no script. There is no set thing that offices are calling patients with and talking about. And so what that does is that leaves these conversations up to the wind. People start talking and rambling and coming up with different excuses and reasons, and there's no control of the conversation. So when you have a script, it helps really focus it and make it more effective to actually get the result that you are trying to get, which is for that patient to come in and schedule treatment. All right. The third reason is that teams feel like they are pestering patients, right? This is a big reason why a lot of practices don't follow up with their patients, because the actual person on the phone feels like they are pestering the patients. And then to compound that, the team doesn't actually understand the power of a follow-up. They don't. They see it as very myopic and very, oh, if I call them, I'm bugging them. Well, if that's your intention, is to bug them, then that's what you're gonna do. You're gonna bug them. But if your intention is to be a reminder and to politely bring the topic of this procedure back to the front of their priorities, well, that's what it's gonna be. It's gonna be a friendly reminder. And so it all depends on how the team is perceiving it and how they're going about doing it. We will dive into this a little bit later in the training. So do you wanna know how a simple follow-up call can turn hesitant patients into committed ones? I used to worry about patients who said they needed to think about treatment and then they just vanished, right? But then I decided to start following up with a simple call. And I found that these calls actually showed patients we genuinely cared about them, and it It reminded them of their treatment, and it brought it back to the top of their priority list. And to my surprise, many actually ended up moving forward with treatment that they initially were hesitant on. Patients told me that they appreciated the reminder, and it felt like it was supportive and personal rather than pushy. And so what started as a simple follow-up turned into a way for us to build stronger relationships and increase our treatment acceptance. And so by making the extra effort, we turned potential losses into real gains, and we showed our patients that we're truly invested in their care. Now, do you wish you had a step-by-step follow-up system that ensured that every patient who walks out saying they need to think about it or talk to their spouse actually gets checked on? This is where the Clear Fortune follow-up system comes into play, okay? So here is how to do it from a systems standpoint. We're gonna break this thing down. First, create a spreadsheet or a list that you can have all the patients who were treatment planned for aligner therapy. Now, if they don't say yes to treatment on the spot and they say they need to think about it, talk about it, do whatever the excuse is, all your team has to do is ask, how long do you need to discuss or think about it? So let's say the patient says that it needs, a week to think about it. Then all you have to do is have your team respond and say, is it okay if I reach out to you at the end of next week just to see how the conversation went? So the team member then needs to have a daily task to check the list and make the scheduled calls, because this is where the system comes into play. And so on the sheet that you guys have, they need to keep track of the date they followed up with the patients and then what the outcome was of that follow-up. And so if they didn't respond, then they need to do another follow-up the following day and update the sheet accordingly. If there is still no follow-up, you can make note in their chart to bring up aligners at the next visit, right? This is for those patients who they just don't answer the phone, you can't get in contact with them. Cool, they gotta come back in 6 months anyways for that checkup, so you might as well bring it up then. This is how you really put a button on the entire process and make sure that you are still talking about this treatment with the patients who need it. Okay, while I have you with me, let's take this one step further. Now, imagine if you could communicate to your patients without physically speaking to them. It's called email, all right? So for every patient who leaves your office and they don't move forward with aligners, your team should subscribe them to an email follow-up sequence. And so what you can do is you can use an email sequence as a way to nurture your patients and keep the treatment top of mind on top of the phone call follow-up. You're probably thinking, okay, how do I do that? All you have to do is just create a 7-part email sequence. It's pretty much you pre-make it, right? You pre-write the emails out. And then what those do is they can give information about the procedure, the estimated time of the treatment, why they may need it, the benefits of getting the procedure, instructions about the procedure once they actually begin. You could put pictures of previous patients where you're showing the transformations, and then you want to have a deadline at the end to book their appointment to start the treatment. Now, this works because it's another medium to connect with your patients in, and you are reminding them about the treatment as well as giving them more information about the procedure that they may have forgotten from the appointment. Because you need to remember what you say to the patient in the chair. There's this crazy phenomenon where when they get out of the chair and leave the office, they forget everything you said. So think about how convenient and amazing it is to have all those conversational pieces in an email. And you're probably thinking, well, every conversation's different, and well, what if this patient's different than that one? They're not different. You just are giving general information tailored to that procedure, and you are giving ballpark estimates, right? Because if you're following the systems and strategies that we go over in this program, you are going to already just be taking on cases that you can finish in 6 to 8 months. So you don't need to tell the patient it's gonna take a year or a year and a half. Make sense? Now, here's the bonus point where you can crank this strategy to the highest level. What you need to do is incorporate a video in the email sequence. So link a video of either you breaking down the procedure with the most common questions and concerns about the procedure, or link one of my videos that I already made because I got a bunch of them and they're tailored for patients talking about different pain points. Okay, just go to the playlist, pick one or a few that you think are useful for patients, and just put the link in the email and tell them to watch the video that a fellow dentist made. Super easy, super simple. The playlist is called Clear Aligner Series. You can go in there and that's where there's a bunch of videos. Now, if you wanted to do this by yourself, all you'd have to do, sit in your office, grab your iPhone or your camera, press record, and you can just have a session where you're just talking about the procedure as if you're talking to the patient in the chair. That's a super easy way way to do it. Another way, if you wanted to do it, is you could just have you could role play with a team member, and this would be kind of a cool idea. And you could literally record the conversation of you talking to the person in the chair. So that way the patient almost gets an over the shoulder or a in the moment type experience. And then you just can upload this video on YouTube, and then you just share that link in the email. Very simple, right? And giving video in an email is a very, very modern way to do it. Now, most dental offices don't do this, okay? Realize that, guys. How do I know this? Because you're watching this video, and I know for a fact you aren't doing this technique because I just came up with it, all right? And so my simple ask is that you go and implement it and see the results for yourself. And once you do that, please come back to the video, drop a comment, or DM me on Instagram and let me know, did it work for you? I really, really want to know, because at the end of the day, I founded this education platform, Clear Aligner Advisor. We've helped a bunch of dentists already. They made a bunch of money doing aligners. And if you want to go further on any training, we got a bunch of them at the website, clearalineradvisor.co. There's free trainings as well as our paid courses, Aligner Blueprint and Aligner Launchpad. And like I said, you can always DM me on Instagram at dr.avi. And so I wanted to let you know that you are probably investing too much money in marketing right now, and it is hurting your business. So if you want to know when is the right time to start investing marketing dollars to grow your practice, go watch this video right now. I made it just for you.